Have you ever wondered whether your penis size is truly as important as society makes it out to be? The question might stir a mix of curiosity, insecurity, or even discomfort. Yet, it's one that millions of men grapple with at some point in their lives. Whether due to personal doubts or the unrealistic standards perpetuated by media, size often becomes a topic that shapes how men perceive their masculinity and sexual confidence. The truth, however, is both simpler and more surprising than you might think. Penises come in all shapes and sizes, and for the vast majority of men, their measurements fall well within a range considered entirely normal. So why does this fear persist? And what does normal even mean when it comes to something so personal? Stick around, because by the end of this article, you'll have a fresh perspective on what size truly means for your sexual health and confidence. This isn't just about information. It's about empowerment. If you haven't joined our community yet, I invite you to hit the subscribe button and turn on the notification bell so you're always up to date with our latest content. I'd love to hear your thoughts on today's discussion. If you find this content helpful, drop a 1 in the comments below. If it doesn't quite resonate with you, leave a 0. Your feedback is invaluable. It helps me craft videos that better suit your interests and needs. Now let's dive right in. When it comes to penile size, variety is the norm. Just like fingerprints or facial features, no two penises are exactly alike. Length, girth, and even curvature can differ widely from one man to another. While these differences are perfectly natural, societal pressures often lead to comparisons, fueling unnecessary concerns about what is considered normal. But what does normal really mean? To answer that, we need to turn to science. Bookmark: research shows that the majority of men fall within a relatively predictable range when it comes to penile size. This is because human traits, including physical attributes, tend to follow a bell-shaped curve, known as a normal distribution. In this curve, most values cluster around the average, with fewer occurrences as you move toward the extremes. This statistical phenomenon is measured in terms of standard deviations, which help quantify how much an individual measurement deviates from the mean. For penile size, this translates to the majority of men being within one standard deviation of the average length. For instance, in studies measuring erect penile length, the average is approximately 13.12 centimeters, 5.16 inches, with a standard deviation of about 1.7 centimeters, 0.7 inches. This means that most men, around 68%, have an erect penile length between 11.42 centimeters, 4.5 inches, and 14.82 centimeters, 5.8 inches. A smaller group of men fall outside this range, but even then, they typically aren't far from the mean. The key takeaway here is that size varies, and the majority of men fall comfortably within the spectrum of what is considered normal. However, it's also essential to understand how measurements are taken, as inconsistencies in methodology can lead to confusion and misperceptions. Accurate penile measurement is more complex than it might seem. To ensure consistency, medical professionals use specific techniques that eliminate factors like arousal levels or subjective biases. The most reliable method is the stretched penile length measurement, where the penis is gently stretched to its maximum length while in a flaccid state. This measurement closely correlates with the length of an erect penis, making it a useful standard for research and diagnosis. Additionally, measurements are taken from the pubic bone to the tip of the glans, ensuring that fat pads around the pubic area don't distort the results. Circumference, or girth, is another important metric, often measured at the base or midshaft of the penis. Together, length and girth provide a complete picture of penile dimensions, allowing for accurate comparisons and medical assessments. One of the most significant benchmarks in penile size studies is the concept of micropenis. This medical term is defined as a penile length that falls more than 2.5 standard deviations below the mean. For adults, this typically translates to an erect penile length of less than 9.4 centimeters, 3.7 inches. While the term might sound alarming, it's important to recognize that cases of micropenis are exceedingly rare, occurring in only about 0.14% of the male population. Micropenis is often diagnosed in infancy or early childhood, as it is typically linked to hormonal or developmental factors. Early identification is crucial because treatment options, such as hormonal therapy, are most effective during developmental windows. In adulthood, the diagnosis of micropenis is less common, as most cases are identified and addressed earlier in life. Despite its rarity, the topic of micropenis can evoke significant emotional responses, often tied to societal expectations and personal insecurities. Understanding the science behind it can help demystify these fears and provide a foundation for informed discussions about treatment and self-acceptance. Diversity in size is not just a biological reality, but also a reminder that no single number defines normalcy or adequacy. Measurements provide useful insights, but they are only one part of the story. What truly matters is how you perceive and value your body, regardless of where you fall on the spectrum. While size diversity is a biological fact, societal influences often distort perceptions and fuel unnecessary anxieties. What are the most common misconceptions about penile size, and where do they come from? Let's explore the myths and the truths behind them in the next section. Despite the natural diversity in penile size, societal pressures and misinformation often paint a very different picture. Many men worry unnecessarily about their size, driven by unrealistic standards portrayed in adult media and perpetuated by societal myths. These portrayals typically showcase extremes that are far from the norm, creating skewed perceptions of what is average or desirable. Such exaggerated depictions can make even men with entirely normal dimensions feel inadequate, fueling a cycle of insecurity and self-doubt. The power of media in shaping expectations cannot be overstated. Adult films, for example, frequently select actors with above-average sizes, creating a distorted view of reality. These portrayals are designed for entertainment, not education, yet they often become the reference point for what men and their partners believe to be standard. Social media platforms, too, contribute to the problem by promoting conversations and memes that trivialize or exaggerate size, further embedding false narratives in public consciousness. In contrast to these pervasive myths, medical research provides a much-needed anchor of truth. Numerous studies have shown that the overwhelming majority of men fall within a narrow range of size that is well within the bounds of normal. Moreover, the condition of having a truly small penis, medically termed micropenis, is extremely rare. Statistically, only about 0.14% of men are diagnosed with micropenis, defined as an erect penile length of less than 9.4 centimeters, 3.7 inches. This figure is far lower than the percentages often assumed by the general public, highlighting how distorted perceptions can be. Despite its rarity, the fear of having a micropenis persists among men who may not have any reason for concern. This phenomenon, sometimes referred to as penis dysmorphia, involves an exaggerated preoccupation with size and can lead to significant psychological distress. Even men, whose measurements are comfortably within the average range, may experience anxiety due to these unfounded fears. This underscores the importance of education and open dialogue in addressing the root causes of such insecurities. The psychological toll of these misconceptions can be profound. Men who feel they don't measure up often struggle with self-esteem, which can affect their confidence in relationships and their overall sense of masculinity. These feelings of inadequacy are not merely personal. They are often reinforced by societal attitudes that equate size with performance, dominance, or worth. Over time, such pressures can lead to avoidance of intimacy, difficulties in communication, and even mental health issues such as anxiety and depression. However, knowledge is a powerful antidote to these fears. Understanding the scientific realities of penile size can help dispel myths and provide reassurance. For example, knowing that the average erect length is around 13.12 centimeters, 5.16 inches, with a standard deviation of 1.7 centimeters, 0.7 inches, places the majority of men well within the range of normal. Furthermore, acknowledging the rarity of micropenis emphasizes that most men's concerns are rooted in perception rather than reality. Societal attitudes, though slow to change, can also be challenged. Initiatives that promote body positivity and inclusivity in discussions about sexual health play a crucial role in breaking down harmful stereotypes. Men are encouraged to focus less on arbitrary measurements and more on qualities that truly matter in intimate relationships, such as communication, empathy, and emotional connection. It's worth noting that while the conversation around size often centers on men, it also affects their partners. Unrealistic expectations can create unnecessary pressure within relationships, leading to dissatisfaction or misunderstandings. Educating both men and women about the realities of penile size can foster healthier dynamics and reduce the stigma surrounding this topic. Understanding these misconceptions and their impact is the first step toward overcoming them. By focusing on facts rather than myths, men can reclaim their confidence and approach their sexual health with greater clarity. The journey to self-acceptance begins with education, and it's a journey worth taking. With the myths debunked, it's time to explore the rare cases of micropenis more deeply. What causes this condition and how can it be addressed? Let's dive into the medical factors and treatments in the next section. If you are still watching this video and find these lessons useful, please comment number 1 below to let me know that you are still watching this video with me. Micropenis, though rare, is a condition with significant medical and psychological implications. Understanding its origins requires diving into the complex interplay of hormonal signals, genetic factors, and developmental biology. While the condition affects only about 0.14% of the male population, its causes are typically grouped into 3 main categories: hormonal deficiencies, testicular dysfunction, and idiopathic origins. Each provides critical insights into how this condition develops and the challenges in treating it effectively. The first and perhaps most common cause of micropenis is hormonal deficiency, specifically due to the underperformance of the pituitary gland. This gland, located at the base of the brain, acts as a master regulator, producing hormones that signal the testes to produce testosterone. When the pituitary fails to function properly, a condition known as hypogonadotropic hypogonadism, insufficient testosterone is produced during critical phases of development in the womb or early childhood. Without this hormonal stimulation, penile growth is stunted, leading to the physical manifestations of micropenis. The second primary cause involves the testes themselves. Even with proper signals from the pituitary gland, the testes may fail to produce adequate levels of testosterone. This condition, known as hypogonadotropic hypogonadism, typically results from structural or functional abnormalities within the testes. Insufficient hormone production during fetal development or early life similarly disrupts normal penile growth, leaving individuals with dimensions classified as micropenis. Unlike pituitary-related causes, this form of hypogonadism is often resistant to hormonal treatment, presenting additional challenges for medical intervention. In some cases, the underlying cause of micropenis remains a mystery. This category, known as idiopathic micropenis, is frequently linked to genetic factors that are not yet fully understood. Genetic mutations or chromosomal abnormalities can disrupt the complex pathways that govern penile growth, even when hormone levels and testicular function appear normal. For instance, certain syndromes, such as Klinefelter syndrome or congenital adrenal hyperplasia, are known to have indirect effects on genital development. However, many cases of idiopathic micropenis occur without any identifiable genetic or environmental triggers, underscoring the limitations of current medical knowledge. Genetic testing plays a pivotal role in diagnosing and understanding micropenis, particularly in idiopathic cases. Advanced techniques, such as chromosomal analysis and next-generation sequencing, allow doctors to identify mutations or abnormalities that may explain the condition. Early diagnosis is especially important for determining the most appropriate treatment approach, as interventions like hormonal therapy are most effective during specific developmental windows. Additionally, understanding genetic contributions can provide valuable insights for families concerned about the potential hereditary nature of the condition. The timing of these hormonal or genetic disruptions is crucial. Penile development begins as early as the first trimester of pregnancy, with testosterone levels surging during critical phases. Any interruption during these windows can have lasting effects. For instance, inadequate testosterone production between the 8th and 12th week of gestation can significantly impair the development of the external genitalia, including the penis. Recognizing these critical periods highlights the importance of early intervention whenever possible. In many cases, The underlying causes of micropenis overlap, making it challenging to pinpoint a single factor. For example, a child born with a genetic mutation that affects hormone receptors may also experience insufficient testosterone levels, compounding the condition. This interconnected nature of genetic and hormonal factors makes a multidisciplinary approach essential for accurate diagnosis and effective treatment planning. Addressing the root causes of micropenis often requires a tailored approach that considers the individual's unique biological and developmental circumstances. For hormonal deficiencies, testosterone replacement therapy, TRT, is a common treatment administered during infancy or early childhood to stimulate penile growth. The earlier the intervention, the more likely it is to yield significant results. However, in cases of testicular dysfunction or idiopathic origins, the options are more limited, and surgical interventions may be necessary later in life to address physical concerns. Understanding the causes of micropenis is not just a matter of medical science, it's also a key step in reducing the stigma surrounding the condition. By recognizing that micropenis is often the result of complex biological factors beyond an individual's control, society can foster greater compassion and support for those affected. Early diagnosis and open dialogue between patients, families, and medical professionals are critical to managing the condition effectively and improving quality of life. Now that we've explored the causes of micropenis, the next logical step is to understand the options available for addressing it. How effective are hormonal therapies, and what role do surgical interventions play? Let's examine the treatments and their impact in the next section. The treatment of micropenis is a multifaceted process that depends heavily on the timing of intervention, the underlying causes, and the individual's specific needs. While the condition is rare, advancements in medical science have provided several options to address it effectively. These range from hormonal therapies to surgical procedures and psychological support. Emerging therapies, such as the use of Botox, also hold promise for the future. Each method has its own set of benefits and limitations, making a personalized approach essential for success. Hormonal therapy is often the first line of treatment for micropenis, particularly when the condition is identified early. Testosterone replacement therapy, TRT, has shown significant success in stimulating penile growth when administered during infancy or early childhood. This approach works by mimicking the natural surges of testosterone that occur during key developmental stages. In cases of hypogonadotropic hypogonadism, where the pituitary gland fails to produce enough stimulating hormones, TRT can effectively compensate for this deficiency and encourage normal growth. The earlier the intervention, the greater the potential for improvement, as the penile tissue remains more responsive to hormonal stimulation during developmental windows. The effects of testosterone therapy are both measurable and visible. Studies have consistently shown that administering testosterone in short bursts can lead to a noticeable increase in penile length and girth, often bringing measurements closer to the lower end of the normal range. However, it is important to set realistic expectations. Hormonal therapy does not typically result in dimensions that align with the average size, but can mitigate the physical and psychological impacts of micropenis. Moreover, the treatment requires careful monitoring by medical professionals to avoid side effects, such as premature closure of growth plates or an imbalance in hormone levels. When hormonal therapy is no longer effective or applicable, surgical interventions become a consideration. The most common surgical procedure for micropenis is the release of the suspensory ligament, which attaches the penis to the pubic bone. By severing this ligament, surgeons can allow the penis to extend further outside the body, giving the appearance of increased length. While this procedure can provide some improvement in visible size, the gains are generally modest, often amounting to 1 to 2 centimeters at most. Additionally, the surgery does not increase the actual functional length of the penis, and the results may vary depending on the individual's anatomy. Another limitation of surgical treatments is the risk of complications, including scarring, reduced stability, or altered sensation. For these reasons, surgery is typically reserved for cases where psychological distress or functional concerns outweigh the potential risks. It is also essential for patients to have realistic expectations going into the procedure. This is where psychological support plays a critical role. Psychological counseling is a cornerstone of managing micropenis, regardless of whether medical or surgical treatments are pursued. The condition's impact often extends beyond the physical, influencing self-esteem, sexual confidence, and interpersonal relationships. Many men with micropenis struggle with feelings of inadequacy, which can lead to social withdrawal, anxiety, or depression. Addressing these emotional challenges is just as important as addressing the physical aspects of the condition. Counseling can help patients navigate the emotional complexities of their diagnosis and treatment. Therapists work to dispel misconceptions about size and its significance, emphasizing the qualities that truly matter in relationships, such as communication, trust, and empathy. Additionally, therapy can assist in setting realistic expectations for treatment outcomes, reducing the likelihood of disappointment or frustration. For those undergoing surgery, counseling provides crucial support during the recovery process, helping patients adjust to their new reality and rebuild confidence. Beyond established treatments, researchers are exploring innovative therapies that could revolutionize how micropenis is managed. One emerging approach involves the use of Botox injections. While primarily known for its cosmetic applications, Botox has shown potential in relaxing smooth muscle tissue, which could enhance blood flow and improve penile function. Early studies suggest that Botox might complement existing treatments, particularly in cases where other interventions have had limited success. However, this therapy is still in the experimental stage, and more research is needed to determine its long-term safety and efficacy. As we consider the range of treatment options, it's clear that no single approach can address all aspects of micropenis. Instead, a combination of methods is often necessary to achieve the best outcomes. For example, hormonal therapy might be used during childhood to maximize growth potential, followed by surgical intervention in adulthood to refine the results. Throughout the process, psychological support remains a constant, ensuring that patients feel empowered and supported every step of the way. The treatment of micropenis is a testament to the importance of holistic care in medicine. By addressing not just the physical, but also the emotional and social dimensions of the condition, healthcare providers can help individuals lead more confident and fulfilling lives. It's a journey that requires patience, understanding, and collaboration between patients, families, and medical professionals. With a clearer understanding of the available treatments, it's time to reflect on how these interventions shape the lives of those affected. What lessons can be learned about acceptance, self-worth, and redefining confidence? Let's conclude with key takeaways and practical advice in the final section. For most men, concerns about penile size are more about perception than reality. As we've explored throughout this discussion, the majority of men fall comfortably within the normal range, and the rarity of conditions like micropenis underscores how often these fears are misplaced. Yet the societal pressure to measure up, literally and figuratively, can create a heavy burden on self-esteem and confidence. This is why understanding the facts, embracing self-acceptance, and focusing on what truly matters is key to overcoming these insecurities. It's important to remind yourself that your value is not defined by a single physical attribute. The societal obsession with size is often based on myths and unrealistic portrayals that have little to do with real-life intimacy or relationships. Partners care far more about qualities like emotional connection, kindness, and communication than they do about specific measurements. By shifting your focus from external comparisons to internal strengths, you can free yourself from the unnecessary weight of these concerns. Maintaining a positive mindset is an essential part of this process. Self-confidence starts with self-acceptance, recognizing and valuing your unique traits, instead of dwelling on perceived shortcomings. If you find yourself fixating on size or doubting your adequacy, take a step back and reflect on the bigger picture. Are these thoughts rooted in reality, or are they shaped by societal influences? Practicing mindfulness, surrounding yourself with supportive people, and seeking out constructive resources can help reinforce a healthier perspective. For those who continue to struggle with doubts, seeking professional advice can be incredibly beneficial. Urologists, endocrinologists, and therapists are equipped to provide accurate assessments, debunk myths, and offer tailored solutions. Whether your concerns are physical, psychological, or a combination of both, consulting an expert can give you the clarity and confidence needed to move forward. Medical professionals are trained to approach these topics with sensitivity and respect, ensuring you feel heard and supported throughout the process. It's also worth considering that modern medicine offers a range of options for those dealing with legitimate conditions like micropenis or other anatomical concerns. From hormonal therapies to surgical interventions, there are effective treatments available for individuals who qualify. However, for the vast majority of men, reassurance from a trusted expert is often enough to alleviate fears and restore confidence. Education is another powerful tool in combating misinformation and fostering self-assurance. By understanding the science behind penile size, you can separate fact from fiction and make informed decisions about your health. Additionally, engaging in open conversations about these topics helps normalize them, breaking down the stigma and encouraging others to seek support if needed. As we conclude, let's not underestimate the role of connection and dialogue in building confidence. Whether through discussions with partners, friends, or healthcare providers, sharing your thoughts can lighten the emotional load and provide new perspectives. For those who are in relationships, open communication with your partner about concerns or insecurities can deepen intimacy and strengthen your bond. Remember, vulnerability is not a weakness, it's a foundation for trust and mutual understanding. I encourage you to continue exploring resources and expanding your knowledge. There's so much more to learn about sexual health, intimacy, and confidence. Watching related videos, reading credible articles, or even joining online forums can further enrich your understanding and provide a sense of community. If you found this discussion helpful, why not share it with others? Together, we can challenge misconceptions and create a more informed, accepting world. If you found this video helpful, don't forget to give it a thumbs up and share it with someone who might benefit from this topic. Have any thoughts or personal experiences to share? Drop them in the comments below. I'd love to hear from you. And if you haven't already, click the subscribe button and ring the notification bell to join our community for more empowering content. Thank you for watching, and until next time, embrace the journey with confidence.